Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. With me today is Dr. Bill Morice, the President and CEO of Mayo Clinic Laboratories. This is our weekly discussion with Dr. Morice, in which we learn about updates in the field of laboratory medicine and pathology.
Hi, Bill. Welcome back.
Hi, Bobby. Good to see you, as always.
As always, it's always something I look forward to each week.
Me too.
Well, I thought we could talk about something looking way back when you were chair of the Department of Laboratory Medicine and Pathology, DLMP. You started a quality management system, and the system has really grown and matured. We now use it as such an essential part of our quality management system within DLMP for excellence in patient care testing. And I believe it mostly started with you. And I thought that'd be a great topic for you to tell us a little bit about why and what value you see in this.
I mean, it's first of all, it's I'm happy to talk about it. And second of all, that's one of the really cool things about leadership transition is that you see some things that there's a whole there's a whole graveyard of my ideas that were bad ones, right? But then you realize there were some
There's
that
some
were
really good
actually
ones,
that
Bill.
really persisted. When you rotate out and some of those things that you started persist and grow, you're like, wow, that
Mhm.
really we were on the right track, right? And so for me personally, I'm not. I don't think of myself as a process person, right? And quite quality for a lot of physicians and scientists, it's like not we don't think in that way. And yet, going all the way back, how we do our work is so important. So it's, what I started to see over time was that I joined the department in 2000. We continue to grow and grow and grow through Mayo Clinic Laboratories and the volumes that were coming in. I ran the flow lab, which was predominantly serving the outside patients. And then you start to think about, well, how do I ensure that as we're doing more, it shouldn't make a difference to a patient whether I had one case that day or whether I had 10. They should have, or 50. I have to have a
Mhm.
quality system in place that allows me to scale the work that I do and the knowledge such that it's always consistently of the highest quality for a patient. And that was the perspective. That's when I got passionate because then it's all about how you do your work, right? And to your point, and the quality we think about quality, but really how we work and how we're measuring how we work such that we can be confident that if someone calls and says, I have a question about this result, you don't have this heart drop moment of, boy, did I not deliver what that patient needed? I mean, that to me is the essence of it.
Mhm.
Now, the other piece of it that I got more, and once I had the opportunity, and you and I both served, had the opportunity and the privilege to serve in the department chair role. And you're over now this big operation, which has
Yeah.
grown dramatically over my career here at Mayo Clinic. It's such that it's now a long time ago that I was department chair, which is a bit ironic. And you realize that there's a lot of those individual activities and the labs, a lot of quality activities. But the one thing I heard, which was very intriguing to me at one point, was from a quality consulting group about polishing apples. And so the thought was when you have complex organizations, they often get really good at polishing their apples, but no one's
Mm.
worried about making the pie. Right. And I could see that at DLMP. So we had individual quality units, but it's like we're an integrated practice and our laboratories are integrated around the needs of a patient. And yet our systems don't always support going from one area to another or taking a piece of information generated in Clin Micro and marrying that with a piece of information that's generated in hematopathology to make sure that we're getting the best total answer. So that was the other thing that I really got passionate about. And then last but not least, circling all the way back, when there are those challenges, it falls on our staff. I mean, our staff are all very highly motivated about doing the best thing for our patients. And so it creates actually frustration. Either they see a system that's not delivering as it should, or more often, for it to deliver it as it should, they're left doing extra work, right? They're left doing work that's really probably not value add for a patient. And
Right.
so but yet it's required if we're going to be true to our values, our Franciscan values, our rich ties values of the needs of the patient come first and everything that goes with that. So that's why that was my thought behind starting up with it. So it's really gratifying to see that and to hear now with Dr. C and George as a leadership team, they're like taking it to the next level.
Yeah, they really have. And of course, quality's always been what the laboratory is all about. We're so quality oriented for everything that we do. But this is really taking it to another level, like you said. And I think it really began with you and maybe a bit with Frank Cockrell, our former chair, starting with lean management tools, first in, first out, making spaghetti diagrams. We started learning the basic tools. This is now 15, 20 years ago. Um, but it became more comprehensive, and we started having teams and huddles and managing for daily improvement boards. And now it's at a level where I think we've really refined the process where we have huddles at the laboratory level, the divisional level, and then all the way up at the departmental level that really quickly escalate problems. We empower people. We have now every single staff member is empowered to be that problem solver. And then we have these active walks called Gemba Walks, where we go to the quality boards and we look at what our laboratories are tracking. And it could be just something small, the pebble in the shoe, so to speak, a small problem. But ideally, it would be the big problems. How can we solve the big problems so that we can be efficient and turn around specimens for our patients? And that is better patient care.
Yeah, no, that's really it's so it's gratifying to hear that it's evolved to that level. The other thing, so really when you talk about the inception, I actually remember, I think this actually even predated Dr. Cockrell, where we started to think in this way. Going back to even when Dr. Hansen was in chair as a chair, because that's the first time we started to see system engineers under a
Yes.
gentleman named Brian Nass that came in. It was really to help us start thinking about our work in this way. And so on the one hand, a lot of our audience at Art Mayo might say, because people have approached me and said, we don't have system engineers. We don't have the kind of infrastructure that you have at Mayo Clinic to do something like this. And I think the reality is, yes, we are blessed with great support from Mayo Clinic in our labs, but it's really just a way of working. You don't need
Hmm.
all of those things. It really is just it's mostly around communication, actually. And it's
Yes.
interesting, I don't hear it as much now. I mean, the sort of the poster child, if you will, organization for this was Toyota, where Toyota was the first to really put a lot of these working measures into place, where anyone on the they had a complex supply chain of putting together cars, but anywhere along the way, someone could raise a red flag and stop a process that they thought wasn't working, and so it really is, just getting engaged, not thinking of quality as something remote, not thinking about it as a checklist for CAP, but really thinking about how you do your work, because ultimately it makes it a much more gratifying environment to work on, because you feel like
Yes.
someone listens to your problems, number one. Number two, for those things that you have the power to change, you drive that to let the people actually change it and not always have to run for approval. And also then, if it's above that level, that you can go for support. So it really creates that whole teamwork environment, that culture of safety, if you will. That's to me the probably the biggest is, and then everyone benefits,
Yes.
and so that's really the beauty of it.
Yeah, and I'll add a couple things. First of all, people may say, not just resources, but time. Who has time to do all these who has time to do all these huddles? Well, really, the huddles are very quick. They're very efficient. So they're very efficient. 5 to 10 minutes. Everyone gets together. The lab staff take turns running the huddles, so it's not the supervisor. We really are empowering the bench staff, the team members to bring up problems and issues. They go through some check items, any unexpected problems, anything that might delay patient results. Then those things get escalated very quickly if there is something that might delay patient results up to me at the tier 2, being the division chair for clinical microbiology. And if it's important, that same day, again, I escalated up to tier 3. And so very quickly you get that visibility and everyone is in the know about the big issues that need to get escalated up. So that's a really important component of this. And going back to what you said too, then some of the tools that were introduced, we also now have MDI teams, managing for daily improvement, where people learn the different tools that are available, things like spaghetti diagrams and Pareto charts and root cause analysis, and they're empowered to use those. And then the Gemba Walks, Gemba meaning where things occur, that's where we have teams of coaches that go around to all the different laboratories and helped coach them with their problem solving. So it's multifactorial or multi-component, but it's very efficient. So it actually doesn't take the time you would think. And anyone can get trained to do this. So you don't have to have a process engineer. You don't need to have specialized staff if you have people that are willing and interested in getting that training.
Yeah, the tools are readily available. And I would say on the time side, kind of two things. Number one, you actually will probably burn less time because
Hmm.
if you're a lab director, if you're someone in the lab, you're spending a lot of time. Who do I talk to about this? That means you're not on the bench, right? If you're a lab director, you're always dealing with things episodically and you're trying to scramble. And how many of those do you have in a day? Honestly, once you go through the transition, it's much more efficient because you're only interacting with stuff that you really need to be interacting with. The other thing I would say for us, and I was under the old model, I was asked by the institution to be the CLIA lab director for all the laboratories in the Rochester campus. That's 26 million tests, right?
Oof, yeah.
Um, Annually. It's like I sign off that I'm actually responsible in measuring these things. And I just very much relied on we had a great quality system in place, don't get me wrong.
Hmm.
But this, for any lab of any size, as a CLIA lab director, it really gives you assurance that you're living up to the responsibilities that you have when your name is on a report that
Hmm.
it is trustworthy. So it's and honestly, it just makes it a more enjoyable place to work. So
I've really come to enjoy the huddles. It's a time to get your team together. And again, you're not standing there for 30 minutes. You keep it efficient. You cover the important things. And what I've seen is, I mentioned, I've been so impressed by how quickly you can escalate issues. When I was in the interim department chair role, it might be a day or two before I find out about something big that's happened, a big piece of equipment, a mass revision. You hope these things never happen, but rarely they do. And the department chair really needs to learn about them right away. And yet there would be so many other people involved, and there was no mechanism. Someone just had to remember, oh, I need to let Dr. Pritt know about this. Now we have the structure where that would get escalated up at the daily tier 3 huddle. And Dr. C, our department chair, would immediately know there is this potential issue and it is getting addressed. And whether it's, our IT group, some other group, everyone's knowledgeable about it. So they all jump right in. So
yeah,
that's really
wow,
been beneficial. The
that's super.
last thing, yeah, the last thing I'll mention we didn't talk about, but there are these things called Kaizen events. And you're right, they all come out of the Toyota model. So these are Japanese terms. They sound very unfamiliar to people like Gemba Walks. And so Kaizen events are really interesting. They're multi-day events where you tackle the big problems, the ones that you can't just solve with a 5-minute coaching session at a huddle board, where you really need to delve in and pull all the stakeholders together. And this is where you can really achieve those breakthrough improvements. There have been some groups that have already done these where they've achieved like an 85% improvement in efficiency, like these really big rewards. So you put the time in. People may say, well, who has a couple days to use for this? Yes, but then if you are 85% more efficient, let's say, well, then you just made up for that time that you spent for that Kaizen event.
Yeah, no, that's remarkable. Number one. Number two is but my closing thoughts would be, um, if you go try something, there's a lot of good support out there. It's not super expensive. It's quite accessible. If you try it, just remember it's going to feel like anything. It'll feel awkward
Hmm.
at first, right? You got to give it a little time, and your staff will probably be following the 25, 50, 25 rule, where 25% will be like, it's never going to work. 25% will be this is the best idea ever, and the 50% will be in the middle watching and deciding which side. So you have to have a little, as a leader, if you're going to do this, you have to have a little bit of perspicacity. You have to be stick-to-itiveness, right? But like to your point, the payoff is real. And honestly, the other thing, what it boils down to, and people don't see it or feel it, we haven't talked about government affairs for a while. The specter of decreasing reimbursement for lab tests is still out there. And the
Yep.
reality is, what does that do? That allows you to, that efficiency allows you to keep your lab tech, and allows you to keep some things that as a lab starts to get squeezed financially, that you keep resources that you're using to serve patients and to serve the people who work with you to do that. So it's very worthwhile effort. And honestly, healthcare is kind of a lagging industry. I mean, a lot of other industries look at it already. And we just sometimes I think about that a lot, even like during the pandemic and all the burnout and all those things, is because we just haven't thought in that way. And so it's a good opportunity to take some best practices from others and put them in place.
Yeah, Bill, you, as always, bring up really good points. Some people may be listening to our podcast and thinking, oh, maybe I'll try that in my place. Obviously, it requires some preparation, education for yourself. There's some books out there on lean management principles. You may want to get an advisor or someone who knows more about it. But then, yes, you have to get your people engaged. There's change management. You need to make sure everyone knows what they're doing. You don't want to just throw something into your staff like this. And there's probably ways to start small. We've been evolving our journey for this managing for daily improvement since, like you said, back before even your predecessor, all the way back to Dr. Kurt Hansen. So it's something we've been on a journey for a while. But there's resources, lots of resources out there to help people who might want to learn more.
There are, for sure. And it's definitely, if you're interested, you should check it out. And look into it. And you don't have to be big like DLMP. You could be any size, and
Any
you'll feel the
size, yep.
benefit.
Well, thanks for all the information, Bill, and thanks for that historical perspective of how this all started.
Yeah, I guess I have to laugh because I remember when I did my year of internal medicine. Once a person got to a certain age, you'd be rounding in the morning and be like, well, they are the family history, because you're supposed to get a family history. So I kind of feel maybe I'm hitting that vintage in DLP. You don't have to get the DLP. He is a DLP history. I've been around for forever.
Oh, too funny. Well, the family history is important. I feel like I'm starting to get to that point now too. So I'll be there right with you.
Sounds good.
All right. Thanks, Bill. Until
Till
next time.
Yeah, you got it.
Thank you for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and tune in every other Thursday for new episodes.